Hi, I'm Dr. Nicole and I'm one of the acupuncturists here at the Lacey office, and today we're going to be going over a technique called Gua Sha, which loosely translates from Chinese into scraping or rubbing, and it's used by using a tool either made of bone or porcelain, and it's rubbed on the skin with some cream or some other type of lubricant to bring up a reaction. And basically what it's doing is it's taking any what we call like stagnation or like dead blood in the tissue and bringing it to the surface. And what we mean about by saying dead blood is that it's blood that's kind of stuck in the muscle tissue, and this can be like deep in the muscle belly from like say like a blunt force trauma or when a muscle is pulled or strained, and the technique will actually bring that all to the surface so that your body can process it out through its lymphatic system. So we're here today with patient Jo. She has some chronic neck and upper back and shoulder pain, and we're going to be doing the Gua Sha technique on her. So I'm just going to grab some cream here just to kind of help lubricate a little bit. So this cream is actually a blend of some Chinese herbs and some CBD oil. And what this is going to do is it's going to help reduce the amount of inflammation in the tissue, also help circulate blood flow. And this will help then with the range of motion and decrease the amount of pain that she's feeling as well. So I'm just going to take my Gua Sha tool here, and today we're going to be using the china. It's like a bone china tool. So I'm just going to go along here. We're going to start with her trap. I'm just scraping a little bit. I usually go with medium pressure. And, you know, as I talked about earlier, there's different levels of, intensity that might happen. And you can see here she's getting a little bit of pinking of the skin, a little bit of red, we have some little petechiae. That shows that this is more of a chronic condition. The more acute it is, or if it's something like a blunt trauma, you might get some like really deep dark red, some purple coming up. So this is releasing all of that stasis, that blood stasis that's in the tissue. That way she can get it processed out through her lymphatic system. So later on today, she'll have a lot better range of motion, the inflammation will be down, and she'll also have decreased pain. And this can be added on to any acupuncture treatment as well. It usually takes between 5 and 10 minutes, just depending on the intensity of the injury and how much, of we call this Sha, how much is coming up in the tissue. How are we doing so far, Jo? All right, good. And the level of intensity can be increased or decreased depending on the comfort level of the patient as well. So if it's feeling it's a little too much, we can always back it off. Most people say it feels kind of like a nice kind of medium pressure massage, so it feels really good. It's also nice and warming to the tissue too. So we've been doing this here for about 3 minutes, alternating sides, and as you can see, Jo has a little bit more of this red, deep red petechiae on her right shoulder. So this area is a lot more stagnant for her. This is where she has a lot more of her pain. Over here we just have a nice pinking, which is bringing blood flow to the tissue, but there isn't any type of congestion in there that needs to get processed. So we just kind of like to even it out just to make sure everything's feeling nice and good. And I'm just going to give this a little bit more work because I can feel there's a little bit of resistance under here. Is this pressure okay? Good. So I'm just going to keep going over it and just kind of smoothing everything out. And probably do a couple more minutes and then she'll be set to go home. We always give an aftercare instructions as well, because you want to definitely keep this area covered because all your pores are very open right now. We've opened up everything, so you want to keep it out of the elements, such as like wind, air conditioning, in the summertime, especially the ocean as well, until the marks dissipate, which can usually take between 1 to 4 days, just depending on the level of intensity. But again, if you have any other questions, you can always bring it up to your acupuncturist and they can go over everything with you.